Good evening, and thank you. I feel very welcome here. Is that all right? It's my third time back to Nelson in probably about a year or just over a year, and it's a great community to come back to. What I'm going to do tonight is to tell you some stories, because in a sense, really, our stories are all we've got. And I'm going to tell you a story about Marjorie, for starters, and I will tell you the stories that have had a major impact on not only who I am, but also on what I am doing at present. Some of you may be familiar with the research I did that changed my life and changed my career. And that research was to ask people what it was like to know they were dying. They needed to have either a diagnosis of AIDS or a diagnosis of cancer. And they had to have a life expectancy of 6 to 12 months at the most. And I'm going to tell you the story of Marjorie. I did that study over a period of 3 years. It was probably the most challenging 3 years of my life, because I was living in the intimate stories of pain and suffering, of hope, of death and dying. And it was a time also where I was working in terms of the young men with HIV and AIDS. We had just come through a time when there was no treatment and they died very difficult and complex deaths, to a time when there was medication which might give them 2 years of life expectancy, and then eventually to the treatment we have today that changed it from a terminal illness to a chronic illness. I visited people in their homes mostly, and taped a conversation, but it was mostly a monologue. I didn't have to ask them a lot of questions for people to start talking. I recorded those, and I, both on an audio as well as on a video camera. I transcribed them, identified themes, and went back to their homes and asked them whether I'd really understood their story. So they'd correct me until they felt that their story was my story. I visited Marjorie, I think I visited Marjorie 11 times. She lived in a wonderful apartment where she could oversee the mountains. And although she was going blind, not for reasons of cancer, but for other reasons, every time I went, she served a different type of tea, herbal tea. So I've had 11 types of tea, and she baked a different type of loaf every time I went, a date loaf, a lemon loaf, a nut loaf. I've had tons of loaves. And she'd say, you know, before we start talking, you really need to have a cup of tea. And we'd have a cup of tea. And I think the second time I visited her, she gave me a big hug and said, I'm so thankful that you're here. And she chuckled and she said, you can't hug me because you're the researcher, but I can hug you because I just like having you around. So I got to know Marjorie very, very well. In fact, when I was through the interviews just before she died, she said, you know, I wish we could start over because I've sort of told the wrong person my story. I'd like to do it all again with my family present. And I knew her family story. And she said, not that I'd want you to correct the issues and the hurts between us. I would like you just to sit there and help us listen to each other. And after they heard their story, I wish I could also hear the stories of my children. And we won't hear each other's stories. It's too late. So Marjorie was a woman in her late 70s to early 80s. And the first question I would ask them was, so how did you learn about your diagnosis? And she said, I learned about my diagnosis about 10 years ago, and I remember it as though it was yesterday. And she said, you know, it seems always to happen that we get major health issues on the Friday evening before a long weekend, and your family doctor's not the one on call. And she said, that's exactly what happened to me. So I had to wait Saturday, Sunday, Monday, Tuesday morning. It seemed like an eternity before I could see my family doctor, but eventually I got in. Because, the quotes I use in this story is generally true. Parts of the diagnosis I've changed to protect the identity of the people in it, but you know, it's so long ago that I don't even remember all those, who belongs to which story anymore. But she had a mass in her groin. And so they examined it, and they assured her it was benign. It was nothing. She didn't need to worry about it. So she trusted them, but the mass didn't go away. It didn't grow a lot. And so she insisted on seeing a surgeon, and he said the same thing that her family doctor said, and said it's benign, you don't need to worry about it. So she didn't, but she did. And eventually she said, you know what, I'm just not comfortable with this, so could we please just excise it? Can we take it out? Can we remove it? I don't want this in my body. And they arranged for that, and she'd not by then seen both her family doctor and the surgeon many times, and she regarded them as her friends, as her professional friends. And they assured her that it was benign. So she was admitted, they took it out. She was still a bit groggy, and from the doorway of the room, of her room, and in her grogginess, she remembered that the surgeon said to her, oh, and by the way, we were wrong. It is cancer. And I've made an appointment for you to see somebody next week, and turned around and walked away. That story changed my life. Not that day. Because I needed to hear a few other people tell me stories that were very similar. And what did Marjorie respond to when she was telling me that story? For her, she particularly said, the way the doctor talked to me caused me more pain than the pain from the disease itself. And when I work with healthcare providers, I say, put your own discipline in. I choose to stick to the doctor part because I am one. But if you're a nurse or you're an OT or a PT, people talked about healthcare disciplines. The way the healthcare provider talked to me caused me more pain than the pain from the disease itself. And I can remember being at home with my wife, who's an occupational therapist, so we're both involved in healthcare. And I said, you know, ultimately what happened is known in healthcare as iatrogenic suffering. My wife's name is Jean. She said, that term is going to be a very significant term in your life. I disregarded it. I didn't think anything of it, but she was right. What does iatrogenic suffering mean? Very good. And it's usually used in reference to surgery done incorrectly. You're supposed to have surgery on your left leg, and they do it on the right leg. That's iatrogenic. If you take the word apart, iatra means healer, genic means from the source. So from the source of the healer, there is suffering. And the reason I chose that, because I knew that it would get the attention of every doctor in the room whenever I used it. And what did I learn from that? I learned from that what we know cures, who we are heals, and who we are can also cause the suffering in others. And that theme in itself haunted me. And you know what was very interesting, because the people in the study actually asked me to write a book. So that means you have to visit publishing companies. And the very first publishing company I met with told me, we'll publish your book, but you have to take that theme out. I said, which theme? And they said, the one about iatrogenic suffering. I said, this is a research project. I can't take it out. And they said, well, we can't have you saying those things about doctors. I said, but it's the truth. And they said, well, when you decide and you can't get any other publishing companies, then you can come back to us and we'll publish it for you. So lo and behold, I had a literary agent at the time who took me to New York. And I met another publisher there, and they said, we really want this book. And I said, why do you want this book? She said, because you tell the truth. We want the book because of that theme. I said, which one? She said, iatrogenic suffering. We want the book because of that theme. That theme has grown into a training program for family practice residents. It's become the opportunity to speak at conferences. It's helped us develop a training program that begins to ask the question, who am I in the context of the work that I do? Who am I as a physician at the bedside? Who am I standing at in the suffering of another, one human being to another? Because we understand now that hurt people, and healthcare providers are not exempt. My hurts it's Buddhist. If we don't address and repair the pain within us, we'll project it and transmit it to others. So without transformation, there is transmission. And so that was the compelling feature of that story. But it went further than that because I couldn't let go of it. And eventually I was invited by the CEO of Providence Healthcare to start what became known as the Center for Practitioner Renewal, a center that began to look at the psychological support of healthcare providers and of teams in healthcare. What's the price we pay? We pay a price for being healthcare providers. What might it be? Well, every person you ever meet has an effect on you. So every person, every patient I meet also has an effect on me. So out of that can come other things like burnout, distress, vicarious trauma. If I invite the story of another into my life and there's trauma in it, I'm at risk of having similar symptoms to the person who has the trauma. So those of us in healthcare who are inviting the stories in can begin to affect us in a way that's very similar and actually identical to PTSD. I spent the last 15 years or more working with military men in transition from military to civilian life, so have seen a lot of trauma, have addressed it and begun to look at how we can heal the wounded soldiers. And you know, for some healthcare providers, they have similar symptoms or symptoms that are less severe. So it's very important for us to look at our own suffering, but it's also equally and perhaps more important to look at how we address the suffering of others. How do we speak to them? How do we not speak to them? How do we sit with them? How do we stand with them? How do we touch them? One of my biggest regrets is that my book is called What Dying People Want. I wish it would be called Truth, Touch, and Time. It's what we all want, whether we're living or dying. And interestingly, the work that I did subsequently for the 10 years, the past 10 years, looking at the psychological support of healthcare providers is actually why I'm in Nelson. Because there's a group of people through the Collaborative Services Committee, and I asked them for permission to say this tonight, that combines people working in primary care and also in interior health that are beginning to ask, not beginning, they're well on their way, to asking some very difficult and complex questions about what should healthcare tomorrow look like? What should our relationships to one another be like, and what should our relationships to the patients and the community be like? I think they're on the cutting edge, and I only applaud their efforts and hope they can continue because they may just show us, the rest of us, the way to tomorrow. Because the leading healthcare organizations of tomorrow will have people on board who understand the complexity of suffering, understand the complexity of psychological support that we all need, and will understand how to integrate all of that in providing healthcare to the patients. So that's one way of the story. But I'm not involved in any of that anymore. I don't no longer work in the Center for Practitioner Renewal. I'm going to tell you another story that planted a seed, probably in perhaps 1992 or 93, that has resulted in the work I'm doing now. I remember vividly sitting at the nurse's station writing in a chart when a young man, probably in his early 20s, came to the desk and asked if he could use the phone. I said, of course. I lifted it up, put it on the counter so he could reach it more easily. He picked up the phone, and as soon as he said, hello, Dad, I wished I could slip away because I felt like a voyeur. All I could do was pretend to keep writing as I listened to a monologue. And this boy, although he was a young man, said, Dad, I have 3 things to say to you. 1, I need you to know that I'm gay. He paused, and I could tell it was silent. I need you to know that I have AIDS, and again he paused, and it was still silent. And thirdly, I need you to understand that I'm on a palliative care unit. I'm dying. And again, it was quiet. He hung up the phone and walked away. A memory I will never forget. And I've wondered what all that was about, because we had many mums come to the palliative care unit. We used to call them prairie mums because they came from Manitoba, Saskatchewan, and Alberta and stayed with their boys. And they'd say to us, what can you put on the death certificate? Because if the community finds out that they've died of AIDS, it'll be a horrible thing in the community. And so we'd say, we'll put something else on that. You don't have to worry about it. I only remember 2 dads that came. And this young man's father was not one of them. It was the beginning for me of an insight of estranged sons from their fathers because of who their sons are. And it personally had an effect on me because after that I decided, what kind of a father am I? I have 2 daughters. And I remember going home one day and saying to my wife, I'm going to change who I am. And I'm now going to be very available for these 2 girls, and they were still very young. And they will know what it means to be loved by a man, and it's going to be me. So those stories changed my life. And how has that story affected me today? Well, when I started my doctoral work to do this research project, I also started working with men in the military, then RCMP officers, then corrections officers. So as of January of this year, and I'm not here to talk about this project, I'm now working to create a center for the integrity and well-being of men and boys, where we begin to look at the transitions that men experience, whether they're the men who protect us, the men who entertain us through being highly professional athletes, because as they transition, if you saw the Globe and Mail 2 weeks ago, it was a suicide. As they transition from being professional players to being not players, a lot of depression, divorce, and some suicide. We're looking at the transition from illness to wellness with regard to prostate cancer. And then ultimately, we'll look at how are men affected by the transitions of life. So it's had a profound effect on who I am, my 15 years in palliative care. And ultimately, the biggest gift those people gave me, they taught me the two questions we all need to ask before we die. Who am I? And what do I want? Thank you.